responding to this comment, can you do a video on dealing with patients' family members? I'm a new grad nurse and want to quit because of family, and I'm scared to talk back to them. I felt this like in my soul. So I had to respond. Sorry, my coffee maker is really, really loud. Okay, so as a pediatric nurse, we have to deal with families, I think, way more than probably any other specialty, right? And it is so, so challenging. And I'm going to be real. I'm going to be straightforward with you like I always am. First of all, there isn't like a black and white, right or wrong answer. And secondly, because this is nursing, when doing the right thing, we are always at risk for facing retaliation, which is fucked up, right? But that's the reality. So I want to make sure that I am transparent with you on that. Okay, so, there is something to be said for they can sense weakness, like a predator can. So you have to really fake it till you make it, like fake the confidence, if you're super like kind of wishy-washy and, well, I don't know. And, it's up to the doctor. Like they're going to get the sense that you don't know what you're talking about. And that's only going to probably heighten their emotions of an already stressful situation. And, it's not going to help anyone. So you've got to come in there with a certain amount of confidence in what you're saying, which is not easy. But, it's like the first time you go in to do an IV or anything else. Like, you got to pretend like you've done this a million times, right? You also need to walk a very fine line between, like, you're in charge, right? You've got to somehow relay without coming in and saying that. I'm the nurse, like I'm in charge. I'm going to tell you what the plan is. And yeah, we can talk about it. And this is a fluid situation and we can absolutely adjust as we go if things change. But like for now, this is the plan of care or whatever, like you have to have a certain amount of authority in how you present yourself while, this is the tricky part, while simultaneously remembering that this fucked up American healthcare system is all based on customer satisfaction. And you probably have a nurse manager somewhere that only cares about customer satisfaction and patient or family complaints, right? And wants you to be the best, like, hotel, restaurant, server, like that kind of customer service mentality, even though we know that that's truly detrimental to patient outcomes, right? So it's tough. You've got to bring in a level of confidence and knowledge and authority and take control of the situation while balancing it with, I really don't want them to complain. I really don't want to piss them off. How can I soften my approach, my presentation to, make them feel like I'm doing everything for them to help them and I am going to be their advocate. And I think sometimes saying things like, if it gets to that point, I need you to know that I will be calling the doctor. You won't even have to ask, if it gets to that point, I'm going to be the first one to notify the doctor, whatever the actual issue is at hand, that you have to let them know that you are their advocate, right? And you're going to be doing, because you ultimately want the same thing that they want for the patient. So I know that's a very convoluted answer, but unfortunately, that's the reality. And sometimes when we do the right thing and we are only following doctor's orders and following the plan of care and absolutely doing what we know medically is the best thing to do for the patient, there are still going to be those piece of shit family members that complain and want to blame the nurse for everything. I've been on the receiving end of that more times than I care to recall. And yeah, patients' families are often far, far more toxic or challenging than the patient themselves. So I understand how you feel. It's very difficult. And I don't know that this will help, but it is at least an honest, transparent answer.